Okay, so let's talk about one of my favorite topics to talk about, which is, of course, body contouring. Body contouring really defines, in a very generic way, pretty much anything we do to the body. So there's a lot wrapped up in the definition. It can mean liposuction, it could be neck contouring, abdominoplasty, brachioplasty or arm lifts, lower body lifts, gluteal lifts, thigh plasties. Any or all of those could sort of fall under that definition. And what I tell folks is, there's kind of four options. You can do the quick fix, there's non-invasive, minimally invasive, and then surgical, which would be sort of the most invasive of all if you think of things in those scales. Bottom line is there's cleansers, and wipes, and pills, and salves, and stimulation, and external this and that. And I mean, there's a ton of it out there if you're willing to spend your money. But the truth is, there are no quick fixes, okay? There's no pill that's going to make it so you don't have to eat right or exercise or so on. And quite honestly, if you have a surgical problem, there's not a solution but a surgery for it. So let's look into that a little bit more. Non-invasive includes Coolsculpting, Vanquish, Zerona. I have in my practice Coolsculpting. We can talk about that, but there's a talk that was on tonight, The Cool New You, that Ashley and I pulled together. I'd refer you to that for more details. Just understand that if we can kind of squeeze it and suck it up into the applicator, it can be frozen. So it's really best for just isolated areas. When it comes to the areas we can treat, pretty much any part of the body can be treated with liposuction or kind of minimally invasive technology, as you can see by these diagrams. And the thing that's not included, honestly, we can do lower leg and cankles and ankles and so on. In my practice, I have a number of technologies that help me do body contouring. I've got my laser, which is Smart Lipo. I've got my internal ultrasound called Vaser. Power-assisted lipo is really what I do primarily. And in the last year, or a little bit more than that, I've added Renuvion, also referred to as J-plasma, as a radiofrequency way to tighten skin. And it has really supplanted the Smart Lipo and the Vaser with respect to using it for those patients we're doing minimally invasive skin tightening on. Here are the different technologies. Again, I don't use Smart Lipo that much anymore, but happy to talk to anybody interested. Vasers for those really tough fibrous spots, particularly gynecomastia in men. The power assisted really is the workhorse of my practice, and I'd say it was a game changer with respect to how long it takes me to do my liposuction cases. I bet it cut my time in half, which is great for patients. It's sort of less time under anesthesia. It saves money due to lots of aspects of it. And really just phenomenal results with lots smoother outcomes, in my opinion. And then finally, I added Renuvion, like I said, about 14 months ago. I was using Smart Lipo as my primary skin tightener, and when you look across the board at all energies that tighten, whether it's laser, ultrasound, radio frequency, internal, all these internal devices, they all give you about a 30% skin tightening as you compare to what 100% would be corrected with more of an excisional operation like a tummy tuck. I almost always do this in conjunction with liposuction. Part of that is because, as people are trying to decide, am I a candidate for lipo or tummy tuck or things like that, this comes into play. But it can be done as a standalone. Someone who's otherwise thin, just doesn't like skin laxity, this really is a nice way to go through just a little series of poke holes. Here's just some examples before and afters in lipo, and you can see in my mouse here, we're just kind of, let me switch this up here. We're just really looking at these love handles and how much better they are now. Here we see the abdomen, nice and full, and then afterwards much flatter. And you can see this same patient before, that hip roll is completely gone, accentuating the body. Another example of someone who just really looks tremendously different, so much more athletic. The goal of lipo, of course, is to sculpt and to bring out the natural muscular contour and anatomy if it's there. Again, here's that same patient from the side view. And then that patient from the back. Here we see straight up, this was a Smart Lipo case where we get some nice skin tightening before and afters. And again, another patient with really dramatic waistline change. And that's the thing to me that I continue to be impressed with liposuction, is how powerful it is to really shape and create a waistline, get rid of those back rolls and so on. Hard to believe this is the same patient, but if you line up the molds, you can see clearly it is the same patient. And we can safely do up to about 5 liters of lipo and send people home. It's a bit messy. There's a recovery. Guys, this is a great option for guys who just can't lose the weight despite exercising, the gynecomastia, we see pre-op and how much improved it is post-op. Arms is a great place to do liposuction. I like to use Renuvion there, Smart Lipo in this case, where we're really trying to maximize skin tightening to avoid that brachioplasty scar in the future. And then we can do the same thing under the neck. This is a patient at just a little fat pocket, you can see right here. And after going in, removing that, and then using, again, in my hands right now, I'd recommend the J Plasma Renuvion. You can see how we've brought out just a wonderful chin line. Now, she still needs a little bit more work, but that wasn't the goal of that particular procedure, but much better when you look under the chin. And here's a patient who, look at just the age it seems to have taken off of her. This was a combination of working all down here in her neck, under the chin, and so on, but also putting a little fat in those cheeks, and just really changed the whole look of her face and gave her a youthfulness that she had sort of was hiding underneath the fat. Just another example of this obtuse cervical mental angle, and now look how much tighter that is. Again, just a 1 hour little procedure that this type of procedure can be done with just some oral sedation and numbing medicine comfortably for a majority of patients. Again, power assisted, I couldn't really achieve these kind of results before just with traditional liposuction, even with my Vaser, which was really great for getting through fibrous tissue. But this is a combination of removing and then adding to her hips, and we also did a affection for doing the Brazilian butt lift, but added fat to her buttock, as you can see here. Now, I've shown this picture to a lot of patients, and of course a lot of folks are, wow, this is too much for me. Keep in mind that adding fat is really about figuring out what you want, because we can tailor that up and down to what is appropriate for what your body can handle, but also for the look you're looking for. So just like when I'm helping folks pick out breast implants, show me pictures and I can help really define the shape, where the width should be and where the fat should go, but really transformational when you look at this patient's waist post-op. Again, another 360 lipo power assisted case, and then adding fat to her hips and waist to create shape. And look at that back, those back rolls, how much better they are, how much tighter that waist is, and then creating some hip fur and some roundness. Now, it's not going to take care of some dimpling and cellulite. It can make it better, but it's not going to solve that problem, I've learned over the years, but definitely will make it better. Another example of a Lipo 360, and again, really transformational when you look at this side profile on this patient. And again, nothing added to the buttock, but you can see enhanced buttock shape because we got rid of all this fat right here that was kind of hiding that transition from the upper buttock to the lower back. Again, very boxy, square look, really common. Folks say I hate that boxy look I have. Their waist is way up here, and it should be much lower than that. You can see we're above her tattoo here, and now we see the waist coming in at the bottom of the tattoo where it should be. Now, if we're going to go one step beyond that, for those folks who really skin is part of the problem or muscle laxity is, we really have to look at surgical options for body contouring. These could again include neck lifts, abdominoplasties, brachioplasties or arm lifts, lower body lifts, buttock lifts, and then thigh plasties, whether it's in or outer thigh, are two different areas that we do. Here's a great example of a lipoabdominoplasty with fat grafted into the buttock. And again, hard to believe we're looking at the same patient. You can see us here maybe 4 to 6 months out. Wonderful, that pannus is gone, this boxy waist, now we've got this tight waist. And again, bra roll is significantly improved, and again, we have excellent buttock contour where before not bad, but hidden by all this fat through here, and then look how flat that belly is. Again, the same patient from the back, and we see a tighter waist, a little more shape to the width of the hips as we've added some fat through there. Just a straight up tummy tuck, removing the pannus, that which is referring to this hanging over area, and thinning this out and just really tightening this whole belly, giving it a much more athletic look. This is more of a lipoabdominoplasty, and again, a lot of people say, well, why'd she come in when she was pregnant? She's not. She just happens to have that much weakness in her stomach muscles. And as I tell folks, it's not a weakness in the stomach muscles, but the lining around the muscles that hold the muscles in place. And with pregnancies, they can stretch. And I've seen a number of patients over the years who just for a variety of reasons, genetics, dumb luck, their fascia just is very stretchy. And to go from the picture here to her post-op really was about tightening that up. And there's no external or minimally invasive device that's going to do that. Although Renuvion does claim to do some fascial tightening, it's never going to come to the same degree that I can do surgically. So to go from a patient who's tired of people asking her when she's due to one now that's happy to be on the beach in a bikini is really a tremendous, kind of satisfaction for me as a surgeon, as again, we see a different view of her here post-operatively. And look at these big, kind of this waist and hip love handle area. And again, that's what makes this a lipoabdominal by my definition for this patient. Again, another patient with this overhanging belly, hated that, C-section scar tucked up, bra strap rolls, again, not much contour in the back, but just by doing some aggressive lipo at the time of her tummy tuck through back here, removing all that, you can kind of see how the scar falls within her bikini line. Wonderful before and after type results. Again, a patient here who's a little bit on the thicker side ahead of time. We did some pre-lipo as a two-stage type of operation, and then ultimately you can see where we are after her tummy tuck. And then here's that same patient after her two-stage process, where we've now taken what clearly is just a genetic predisposition for where her body wants to put the fat, and now we've taken that down to a nice tight waist, and she liked a little bit more fullness in the upper buttock, so we left a little bit of fat there. The arm lift, as I mentioned, is a great way when you just have skin laxity in this very thin patient, very athletic, very active. You just can't get rid of these bat wings, as people call them. We just go in with an operation. We just leave a little scar here and tighten that up nicely. And then this is really a true buttock lift. A lot of people come in and say, I want you to lift my butt, and they've got some droopiness to it. Well, a Brazilian butt lift, despite the name, is one not originating in Brazil, and nor is it really a lift. It is a fill operation. So for folks who just have this droopiness, this is a 42-year-old patient, if I remember correctly, really unhappy, had some fat grafting done previously by another surgeon, and just came in and just really wasn't comfortable with where things were. And there's, after we kind of extended her tummy tuck scar around the back, and look at the difference here. I did add some more fat through here, but I could never have gotten this skin as tight. And we go from a 40-some-year-old backside to a 20-some-year-old backside, easily hidden in even a low-cut bikini. Very happy patient. And then we see at the side her previous tummy tuck scars here, and this just connected. I was able to raise it up just a little bit for a little different bikini style that she wanted to be able to wear, and how much smoother this buttock crease is compared to here where we see a fold. So in general, these are outpatient procedures, and from the standpoint of that, I have set sort of limits from a safety perspective as far as how long and how much fat we remove, kind of how much we can do at one time. That's all part of our conversation ahead of time. These are all done with a varying degree of anesthesia, but for those big cases, really it's all done in general anesthesia with board-certified anesthesiologists in my practice. Return to work will vary depending on the work you do and kind of what we do, so that's part of our conversation. Activities, when you can start them, how you can sleep, all that's part of a good conversation. And then ultimately people say, well, how long will it last? And the bottom line is, how long do you pay attention? How long do you continue to exercise, eat right, those kind of things. So they should last really decades for those folks who continue to take the work that we've done and just make it better by getting excited, seeing that change that they've, work out for years in the gym, and they don't see their waistline change, and they feel like they're starving themselves, and they're on every diet you can think of. And what we can do in an afternoon or, 3 to 5 hours, depending on the type of case it is something that takes, years, if ever, to achieve. Now they see it, they get more excited, more motivated, and, then they maintain these results. So I see way more winners than losers in that process. So a lot of my folks certainly aren't at their ideal weight, but we're able to give them shape and contour as if they were, and then they maintain it. That's their job and responsibility there. So as I said, body contouring is a tremendous amount of varying different procedures, both non-surgical and minimally invasive, and ultimately surgical. And I love talking about it. Happy to talk to you about it. If you have any questions, remember, live chat is up tonight while this is going on. Love to answer your questions if you're not sure what you need or want or what's right for you. And that's always a big dilemma between the lipo and the tummy tuck folks. Love to talk to you about it. Keep in mind, if you get your deposit in tonight, that there is a discount on the surgical fee. So go to the store for that and check out the other specials that are really tremendous for tonight. Thanks so much for listening for a topic I love to talk about. Enjoy the rest of the evening, and I'll see you at one of the other talks.
All right.
right, as you can see, I've taken my jacket off. As much fun as this is, it's also a little bit of work, so I'm getting into work mode here as I talk about all my favorite things, get ready to answer all these texts and chats that people are running into us. But next up is Andrea. She's going to be talking about what's new in injectables in 2020. Remember, Andrea is my nurse injector. She's a trainer for Allergan in a very coveted position, quite an honor for us at Mancoll Plastic Surgery to have her part of our team here. So look forward to hearing what she has to say. And remember, throughout all the talks, you can live chat questions if you're wondering about is Botox or facial injections from me, how much will I need, things like that. And if we're not really sure on all the answers, or things are just so busy that you're not getting a full explanation for what you need, feel free to just sort of do the gift cards for tonight, and then over the next couple of days to weeks, we'll be happy to kind of get back with you, even have you come in so we can assess what's going on and determine how much Botox you might need or how much of the injectables you might need. So with that said, let's enjoy Andrea's talk.